right. Thanks, Jane. Blurry, distorted vision. It can mean that you have an eye disease called keratoconus. Dr. Key-Whitman with the Key-Whitman Eye Center joins us now to explain what that is and the solution for patients with the disease. Great to see you.
Great to be here today.
Hey, before we get started, you were so kind to me on my birthday. Happy belated birthday to you.
Well, thank you very much. I figure I get a birthday week, so that's good.
You absolutely do. We hope you have a great week. Now, help us understand keratoconus.
And you pronounced it very well.
Thank you.
And, you know, I imagine most of our viewers have never heard of keratoconus, but if you have keratoconus, you know a lot about it. And keratoconus is a disease of the cornea, the front of our eye, that in this disease, the collagen within it that makes it up gets weaker over time, allowing it to bulge forward over time. And it can actually form a cone-like shape that we can see with specialized instruments. And this can cause great distortion and blurriness in the vision because they get very atypical, great amounts of astigmatism that make it very difficult to correct them even with regular glasses.
Do we know what causes the disease?
Well, that's kind of difficult in that we know some of it's genetic, passed down in families, or some that related to allergies in people that exhibit frequent eye rubbing. But for most cases, we really don't know the cause.
Oh boy, okay, but for those who do have it, you mentioned you know you have it, and there's some exciting new treatments for those who do.
Absolutely. It's called Corneal Cross-Linking. And we see a picture of us doing cross-linking right here. And with cross-linking, we can offer keratoconus patients not only a treatment, but something that will stop progression of the disease for the rest of their lives. That's a really big deal because in the past, we could fit the patient with a hard, rigid contact lens. And for many of those patients, they would progress on to a need for full corneal transplant. But with cross-linking, we have a simple two-step procedure. One where we put some vitamin B drops on the surface of the eye, the cornea. In step two, we expose that same area to a controlled amount of UV light, and that's what we were showing in the picture. And this completes the cross-linking of those collagen fibers, so they shouldn't change for the rest of your life, so that can treat the problem, and it can even reduce that weird amount of astigmatism you get, making it easier to correct your vision.
Now, does it hurt, and is it covered by insurance?
Well, thankfully, there's no pain to it at all. We use some simple numbing drops, and the treatment takes less than an hour. And really good news about insurance these days, because in the recent past, it was pretty much if you could afford it out-of-pocket expense, that's the way you had to pay for it. And that was a minimal number of people. But now we're finding that most insurance plans cover the procedure. And certainly when you come in, we'll check to make sure that your treatment's covered as well.
Okay, and the first step for those who want this treatment, and I know you have locations all over town.
Well, that's the easy part. You call or get online and set up an appointment. Now, we only offer this at our Dallas headquarters office, the cross-linking treatment. So when you make your appointment, let us know that you know that you have keratoconus, want to be checked for it, or you want the treatment, and we'll make sure we set it up at the right office. My team and I are at the Dallas headquarters office, off of 75 North Central between Royal and Forest Lane. And when you come in, we'll get your keratoconus evaluated, and we'll see if you're a good candidate for the cross-linking treatment.
All right, hey, great information. Happy birthday week to you. I want to make sure everybody has your number so they can call you, set up an appointment, and say happy birthday at the same time. I hope that's okay. Happy birthday, 214-220-EYES. That's the number, 214-220-3937. Everything's online at keywhitman.com to schedule an appointment.